Good Wednesday to you, 18th day of March 2020. This is Wake Up Wenatchee Valley. I'm Dan Kuntz, your host. We're back at it again. Another busy day, lots of information to pass along your way, including the latest local reaction and what's going on with the COVID-19 pandemic. It has officially now reached our area as far as the north central Washington area. We have 2 confirmed cases. Well, that'll be our lead story when we get to the news, and there is a lot of news, not all of it COVID-19 related. Beautiful weather forecast coming our way. Things are looking good. If you liked yesterday, you'll love today. It'll be a little bit warmer. We had 52 on Tuesday, a couple of degrees below normal. We'll be warmer than that today. And we're getting longer and longer days. The spring equinox, by the way, is tomorrow night at 8:49 Thursday night. That's an early spring equinox, earliest one in over a century, I believe. So we'll get to the weather forecast coming up. Whatever sports we can cram in, who's kidding who, it ain't much. Eric took advantage of that to go fishing yesterday. He filed a report, for lack of a better term, plus everything else you're used to. Very important conversation I had yesterday. We taped it for airing today. Bruce Buckles and Diane Tribble came down to visit me from Aging and Adult Care of Central Washington. Of course, their clients, their patrons, if you will, are in the highest risk group for COVID-19. We'll talk about that with Bruce and Diane in the back half of the hour. Let's take it around the valley with our cameras. Courtesy of Localtel Sky-Fi High-Speed Wireless, the cross camera begins our festivities. It is tilted, it is panned back and tilted up just a little bit as the sun starts to peek over the East Wenatchee bench. The sun will officially come up at 7:06 this morning, so it's almost here. Sunset tonight, 7:12, 12 hours and 6 minutes of daylight. Again, the equinox doesn't mean it's exactly 12 and 12. We have passed that point. We did a couple of days ago. Good morning to Wenatchee, East Wenatchee, Sunny Slope, Badger Mountain, Birch Mountain, and everybody who's decided to start their day with us here on the NCW Life Channel. Very light traffic yesterday. I ran a couple of errands yesterday afternoon after I was done at the office, and there's just not a lot of people out and about. People are self-quarantining themselves, and that's what we're supposed to be doing. Camera number 2. It's a guessing game, I don't know. We have decided that the Rock Island camera could be the place to go, and that's where we're going to visit. Still some snow up there in the Clockham Ridge area and Jump Off Ridge. It'll start melting. We'll be in the 60s by the time we get to Friday. In fact, the first day of spring is Friday, the first full day of spring, and we'll be in the lower 60s. Can't wait to pass that forecast along to you. Good morning to Rock Island, and there's the Rock Island Golf Course, who I will be visiting quite shortly. As you might imagine, camera number 3 is a shot of, I haven't got a clue. Megan, help me out. That's the Tumwater camera. So somewhere down there is Leavenworth. Hasn't gone anywhere. I should have known that because it's obviously pointed to the east as the sun starts to climb up. Just a couple of high clouds, and that's it. And that's what we're going to have today, some filtered sunshine, but it's going to be a little bit warmer. It's 32 outside of our studios. Yesterday at this time, it was 27, so it's already 5 degrees warmer than it was 24 hours ago at this time. And camera number 4. Is that Lake Wenatchee? That's the Two Rivers camera as we look over the Lake Wenatchee area. Again, it's not enough light to make that camera change from chroma key, or black and white I should say, to color. Has to have enough light for the lens to change, and it does automatically. But in the meantime, it's still there. Lake Wenatchee, Fish Lake, good to see you. I did not visit Lake Wenatchee this winter. That's a rarity for me. I don't know why. I just didn't get a chance to fit it into my schedule. So that's our tour around the valley. At about 6 minutes after the hour, we have one more slide to show for you. And again, it's not a lot to talk about. It's a rather quiet weather pattern. There are clouds out there, but it's missing our area. It's either going to the north of us or to the south of us here in central Washington. We're looking good. Temperature is going to be warming up to the 50s today. We'll be in the lower 60s by the time we get to the weekend. And if you live in the Camas Prairie, you could get a little rain this morning. We don't live in the Camas Prairie, so we don't need to worry about that. So that's from the National Weather Service. Patriot Plumbing, Heating, and Cooling gives your home a hug, and they're the sponsor of the weather forecast. Courtesy of the National Weather Service, and again, it's about as quiet as it can be. Lots of sunshine today, right around 58 degrees, so it's going to be warmer than it was yesterday. 33 for the overnight low will be above freezing. That's still below normal, though. Our normal overnight lows are in the mid-30s, about 35 or 36, so still a little chilly on the overnight lows. Mostly sunny Thursday, 56 degrees, 61 for the first day of spring. I'm liking that as we get to the weekend. Saturday, filtered sunshine, 61. A couple of clouds expected on Sunday, a little bit cooler, about 58, 59 on Sunday. Cooler still on Monday and Tuesday as a couple of weak systems come in. We could even get a slight chance of rain on Monday and Monday night. Outside of that, that's about as nice as an early spring forecast as you can possibly ask for. Told you it was pretty good stuff. Hey, kids are out of school. A lot of people are self-quarantining. At least we have nice weather to get out and enjoy. All right, as far as the major mountain passes are concerned, it's about as easy. It's easier than the weather forecast. There are no advisories or restrictions across the board. Live shot of I-90 right now. No advisories, no restrictions. Roadways bare and dry. You're fine. Stevens Pass, again, no problems. No advisories, no restrictions. The roadway is bare and wet. A couple of patches of frost here and there. Nothing to slow you down. Of course, since the ski resorts are closed, there's a lot less traffic on Snoqualmie and on Stevens. The Blue Pass is fine. Roadway is bare and dry. The camera, by the way, isn't working, but I can tell you that there are no advisories or restrictions on Blewett Pass. No significant snow at all in the Cascades until Monday night. So your travel plans over the river and through the woods to grandmother's house, you're going to be fine. Again, no snow at all. Just a couple of flakes here and there. No significant snow anyway that may come down and slicken up the roads until at least Monday night. So that's always good news as well. 8 minutes after the hour, we're going to take a break. And this, as you might imagine, we have a lot of news to get to on this Wednesday. So grab your cup of coffee and come back and visit me in 1 minute. You're watching Wake Up Wenatchee Valley live this morning from Studio 2 in downtown Wenatchee on the NCW Live channel.
Winter is a great time to trade in your current hot tub. Turn your old hot tub into money with Blue Lagoon Pool and Spa's trade-in program. And with Blue Lagoon's home show pricing, you can save $500 to $1,000 off of any new artesian spa or take advantage of a free Bluetooth music experience. Blue Lagoon Pool and Spa recommends draining your hot tub every 3 months. Ask us about our drain and refill special for only $99. Stop on by Blue Lagoon Pool and Spa today.
Join us for Street Talk and Other Stuff with Mike Magnotti on the NCW Life channel. This former police sergeant is plugged into not only the world of the streets, he's an actor and connoisseur of the arts. So join Mike and his guest for, well, Street Talk and Other Stuff. Mondays at 10 a.m., Tuesdays and Thursdays at 2 p.m., and Wednesdays at 5:30. It's Street Talk and Other Stuff with Mike Magnotti on the NCW Life channel.
Just about 10 minutes after the hour, clear skies, 32 degrees, mid-50s, a couple of degrees warmer today. Quite a bit of sunshine really right into the weekend. A couple of filtered high clouds will be visiting us off and on, but outside of that, beautiful spring weather for north central Washington. And here's your news. The coronavirus pandemic has officially arrived now in the greater Wenatchee area. A 56-year-old man from Chelan and a 29-year-old man from Leavenworth are both in self-isolation. The first in Chelan or Douglas counties to test positive for the COVID-19 virus. Both cases were detected by Confluence Health in Wenatchee. Health System spokesman Clint Strand says one of the men was tested at the new drive-through medical station that was set up for just those purposes.
Both of these individuals were tested on the 14th. The first positive result we got back later on in the evening yesterday, Monday. A male, 56 years old. That person is in self-isolation, and their residence is in Chelan. The other individual is a 29-year-old male. We received those results just earlier this morning on Tuesday. Both of those are in self-isolation right now. One was tested at the drive-through location yesterday. These positive test results are not unexpected. This is a result of the increased testing that we are doing, and it paints a better picture of exactly where this is in the community.
Confluence Health says neither man is under hospital care at this time. The Chelan Douglas Health District is tracing their contacts, as you might imagine, through the community. COVID-19 symptoms include a fever, a dry cough, and shortness of breath. More than 1,000 infections now have been detected in the state of Washington. 55 patients have died as of this morning. Local mayors and county officials are taking extra steps to combat COVID-19, including declaring states of emergency. East Wenatchee Mayor Jerry Lee Crawford issued an order Monday that allows her to impose curfews, close businesses, and close public spaces if needed to combat the virus. Here in Wenatchee, the city canceled all upcoming public events likely to draw more than 50 people and said it will take social distancing measures for all public meetings that involve fewer than 50 people. City Hall and the police station lobby closed to the public. Chelan County Commissioners voted yesterday morning to declare a state of emergency in that county. That allows emergency purchases and special meetings and eligibility for state and federal aid. Douglas County and the city of East Wenatchee have shuttered their non-felony court systems. On Monday, East Wenatchee Municipal Judge Chancey Crowell signed an order continuing all cases until at least Monday, April 27th. That same day, Douglas County District Court Judge Eric Bigger ordered all jury trials stricken until May 1st. Bigger says both courts made the decision to help stall the spread of coronavirus. Sorry, don't have that video. Going to move on to law enforcement agencies throughout north central Washington. They're altering their normal operations in response to the COVID-19 outbreak. It doesn't mean if you're a criminal, you can have a field day. That's not the case. For most, like the Wenatchee Police Department, it simply means changes like suspending fingerprinting, handling more calls over the phone, and officers keeping their distance from people when they respond to calls. The Chelan County Sheriff's Office has closed its public reception area, and they have activated their Emergency Operations Center. The Grant County Sheriff's Office is operating their Emergency Operations Center in Ephrata, which was activated on Monday in response to county commissioners declaring a state of emergency there. Grant County has 7 confirmed cases of the coronavirus, and the Operations Center coordinates efforts to reduce the spread of the virus. But the Grant County Sheriff's Office says its continued enforcement of laws obviously won't be affected. Cases of COVID-19 in Grant County. That's where, of course, the first cases were discovered east of the Cascades. That's now up to 7. The county health department says clusters of the disease have appeared in Quincy and Mattawa, including a staff member at Quincy High School, a Mattawa parish priest with the Catholic Diocese of Yakima. Health officials are working to trace their contacts in the community. The Washington State Department of Licensing closed their offices yesterday. They're hoping to reopen by Monday. According to the DOL, they'll be preparing their offices to implement social distancing measures. The agency said even when they do reopen, they will not be administering vision tests because they don't have adequate supplies to constantly clean the vision testing machines. They're also preparing to allow more people to renew online. For now, drivers will not need to appear in person every other time they renew their licenses, and people over 70 will be able to renew online. DOL said even though they hope to reopen Monday, residents should prepare for the possibility of an extended closure. And as an agency that provides vital services to seniors and vulnerable adults, the COVID-19 outbreak has been especially challenging for aging and adult care of Central Washington. Bruce Buckles and Diane Tribble visited me yesterday to talk about the changes they've had to make to protect both their staff and their clients.
In order to try to limit exposure to clients and to our staff, we've had to reduce our services in terms of going into homes and doing assessments, because that's what the bulk of our staff do. We are case managers, and we each have a caseload of individuals who access their programs either through Medicaid funded services, or we have some other programs that are not fully funded by Medicaid, and many of them are family caregivers, so they have family members or friends taking care of them at home. And so each of our staff are responsible for doing assessments and developing care plans to make sure that they have their needs met at home for care. So in order to limit exposure, as I mentioned, we, as of yesterday, have heard from Department of Social and Health Services that we are permitted to do our work over the phone. We're permitted to do assessments telephonically, develop care plans telephonically, and even as individuals who need assistance come to our offices, that we are to serve them with a follow-up phone call, unless absolutely necessary for face-to-face visit.
And that is not the way you normally do business.
That
I'm
is
assuming.
not the way we normally do business.
However, one thing we anticipate is having to do more business. One of the things we are very involved with are the congregate as well as home delivered nutrition programs throughout our 6-county service area. So we work very intensely with senior centers and others to make sure that people have access to good nutrition. So now we're looking at, again, some changes in how that is going about. We're going to have to develop a much more robust home delivery program involving more volunteers. We're looking at a host of different changes that will make us able to serve people in more effective ways and wider ways in the midst of this tragic situation that we're facing.
And once again, my complete conversation with Bruce and Diane will air in the back half of this morning's program. 2 non-COVID items of note. The state crime lab has been called in to investigate after a body was found by a group of hikers off Horse Lake Road. This was outside Wenatchee. This happened yesterday morning. Deputy Chief Jason Reinfeld of the Chelan County Sheriff's Office said that investigators remain on the scene. Few details. We don't really have too many details, as a matter of fact. Crime lab personnel are en route from Cheney. The body was found about 9:30 yesterday morning. And finally, the North Central Washington Special Investigations Unit continues to seek additional witnesses related to that officer-involved shooting back on March 3rd. After reviewing the available video, the SIU are looking for 4 people who may have witnessed the shooting that killed 39-year-old Ryan Eugene Bass of Okanogan County. Authorities are looking for 2 females and a male who were associated with a Subaru parked at a gas station nearby, and a male who was associated with a Jeep SUV that was leaving the store at the time of the shooting. That man was actually contacted by law enforcement at the time of the shooting, but he was not identified. So if you know who those people are, you are asked to contact the Wenatchee Police Department, and that's what's making news on this Wednesday morning. It's been a very busy week here for the news team, and it's only Wednesday. We'll be putting together another newscast for you tonight. It'll air at 5 o'clock, 6 o'clock, and 10 o'clock, and available for you to watch online as well, with a preview, the anchor, Grant Olson.
Good morning, Dan. Coming up tonight on the NCW Life Evening News, all the latest on the coronavirus pandemic. I'll have your very spring-like North Central Washington weather forecast, and Eric Grandstrom will find something to talk about in sports. That and more coming up tonight at 5, 6, and 10 on the NCW Life Evening News. We hope to see you then. Dan?
Thank you, Grant. We'd love to hear from you, and we hear from you. Trust me on that. We try to give you all the tools available in the toolbox, most of it online, of course, related through the internet. You can email us directly, news@ncwlife.com, news@ncwlife.com. You can drop us a line via Facebook. Go to our Facebook page, use the Facebook Messenger, and type it all out, and we'll get it. I can guarantee you that. And if you go to our website, ncwlife.com, first of all, pack a little bit of time, because there's a lot of information for you there, including a really handy guide that Cal Fitzsimmons has put together, kind of a click and go for the COVID-19 outbreak. But there's also a way for you to contact us if you click on the Contact Us icon at the top of that screen, our homepage. Fill out the form, and we'll get it. Going to take a break. Going to come back with whatever sports we can come up with. It is what it is. The obscure holiday today in history, some birthdays for you. Mike McNally's got an opinion, and my conversation with Bruce Buckles and Diane Tribble from Aging and Adult Care of Central Washington. Coming up on a busy Wednesday. We'll be right back.
My name is Lacey Haggerty, and I'm a nurse midwife with Columbia Valley Community Health. I love all aspects of my job because it is a profession that's very committed to empowering women to make decisions in their health care that feel best for them. It's incredibly valuable to me as a midwife that I get to take care of women throughout their whole lifespan. I hope to see you at a future visit because I know you will love having midwifery care.
It's going on 4 decades of doing business in the Wenatchee Valley. And I want people to know that it matters. It matters to me that people choose to do business with us. It matters that people trust us, trust us. That matters more than anything.
Welcome back to Wake Up Wenatchee Valley. About 20 minutes after the hour, let's do sports. Seahawks have been quiet so far on the NFL free market. The free agency, of course, opened on Monday. In fact, they lost a player to free agency yesterday. Defensive lineman Quentin Jefferson has reportedly agreed to a 2-year deal with the Buffalo Bills. Jefferson turns 27 later on this month. He had 3.5 sacks, 26 combined tackles, 10 quarterback hits, a fumble recovery, and 3 passes defended in 14 games last year, 12 of which he started. According to NFL insider Adam Kaplan, the Seahawks did sign an offensive lineman Tuesday, B.J. Finney. He'd been a backup offensive lineman with the Pittsburgh Steelers for the past 4 years. He's agreed to a 2-year deal with Seattle. He appeared in 59 games of the past 4 seasons, including all 16 in each of the past 2 seasons. Well, school's out. Of course, school's been out since yesterday, and so for Washington sports, that means high school sports, all sports are on a hiatus. That means no games, no practices. Coaches and athletic directors have a lot of questions about what's going to happen if and when school gets back into session. The executive director of the Washington Interscholastic Activities Association, Mike Hoffman, released a video to administrators, coaches, and athletes. He says the state spring championships will go on.
First of all, we're taking into consideration that for our senior athletes, this is their very last chance to compete in high school. And I've gotten some very compelling stories shared with me of kids who have spent an incredible amount of time either because they missed last season, they didn't perform as well as they did, or they just want to make this last opportunity the best it is. So we're going to do everything in our power to make that possible without jeopardizing health and safety. If we are able to return to school after April 24th, we will host our state championships as scheduled. If that date gets pushed longer, we will provide updates depending on what we are hearing at that time. So again, we're out of school till April 24th statewide. If we are able to return, state championships will go as scheduled.
Now, there has been some speculation that programs will continue holding practices even though coaches won't be present. Hoffman advises against that.
What we ask in the interim is coaches and athletic directors and any other leaders in buildings, please follow the governor's directive. Do not encourage, wink, wink, or ignore our students getting together to compete in practice. We understand they want to be together. We understand they want to be ready if given the opportunity. But again, not at the jeopardizing people's health and safety. As we continue to get educated on this disease, we're finding people who are asymptomatic are contagious. We're finding out people are contagious before they even show symptoms. We're finding out that younger and younger people are contracting this. So for the benefit of everybody and to speed up the recovery process for the entire state, please follow the directives and show leadership that directs your students not to get together to do this. Let them do their thing on their own time, their own way. That's in compliance with Governor Inslee's request. But again, please follow it, lead with integrity. We will continue to provide updates, what it would look like, assuming we get to return after April 24th, as we vet those out.
Now, the athletic directors from various schools and leagues are meeting over the phone and electronically to discuss strategies and how individuals and teams will qualify for possible postseason competition. There's no decision yet on whether the spring sports schedule will simply pick up where the schedule is when they go back to school, or they'll try and do makeups from all the games that they missed over the 6-week school closures. This is just unknowns at this point. Finally, our own Eric Granstrom, of course, is out and about. He's trying to find things to see and do in the midst of all these sports cancellations. Today, it's part 2 of his multi-part series, No Sports, No Problem.
So, what's a sports guy do when there's no sports? Well, you get out on Lake Chelan and go fishing. Coronavirus. Okay, challenge when you're by yourself is if you can net the fish, actually put it in the box. Fish on. That is a Lake Chelan kokanee. Yeah, so what's a sports guy do when there's no sports? Well, for me, I get outdoors and get a breath of fresh air. And to do so here on beautiful Lake Chelan today was certainly a blessing. Now, yeah, I have the access to a boat and I fish. But you could just get outside, grab the bike, go for a ride, and that'll take care of your social distancing. For me, on top of just getting outside and getting some fresh air and some sunshine, I was also able to provide for Marion and me for a couple of great meals. In fact, let's take a look down here in the box and see all the kokanee, 10 kokanee. Here is the limit on Lake Chelan, and boy, do these fish eat good. So that is our meal, and I don't have to worry about the grocery store and the crowds and the fight, and it certainly felt good for the soul to get out here today. Now, I was guilty of listening to the radio last night, and one story after another that was just bad, and I started to feel bad, and that, I don't know, just foreboding, and I finally just turned the radio off and decided I was going to get outside. So that's what I did, and hopefully you can do the same.
I wonder if Eric's going to come back to work anytime in the near future. And those are just some of the games that people aren't playing on this Wednesday. I had 4 choices for the obscure holiday. It's National Biodiesel Day. That's a good thing. National Lacy Oatmeal Cookie Day. National Awkward Moments Day. That's every day for me, but nope. Back to food related, it's National Sloppy Joe Day. And I actually celebrated a day early. I made Sloppy Joes for dinner last night. The origin of the Sloppy Joe, nobody really knows. Most experts agree that it was a cafe in Havana, Cuba, at a bar called Sloppy Joe's, that the Sloppy Joe was invented in the early 1900s. It goes by any kinds of different names, depending on where you're at. Some people call it the Slush Burger, Yum Yums, Sloppy Janes. Sloppy Joes were mentioned in 2 of the great movies ever made, It's a Wonderful Life and Citizen Kane. They both mention Sloppy Joes. Sloppy Joes were not necessarily easy to make, nor were they actually widely popular until the 1960s when they came out with the premix. All you got to do is make the ground beef, then you can dump in the premix for Sloppy Joes, be it Manwich or whatever it is, and it was down the road you go. Happy National Sloppy Joe Day. It's today. I celebrated yesterday, and I got enough leftovers for lunch today. Enjoy your Sloppy Joe. A couple of napkins are a necessity there. Let's do today in history on this 18th day of March. A friendly reminder that the Revolutionary War, was taking off the shackles of our oppressed overlords, the people of Great Britain, and that was good. But a lot of the Revolutionary War happened because Britain just kept screwing up, and this was a perfect example of that. 254 years ago, March 18th, 1766, the British Parliament repealed the Stamp Act. Of course, the Stamp Act was wildly unpopular. Taxation without representation. The Stamp Act was only around for a year. It was almost exactly a year to the day from the time they implemented the Stamp Act until they got rid of the Stamp Act. But by that point, it was too late. That's a cartoon from a Boston newspaper lamenting, burying the Stamp Act. But by that point, the fuse had been lit. I'm so glad King George was an idiot. That helped us so much. Happened on this day 254 years ago today. Happy birthday to the Stanley Cup. That's the original Stanley Cup, the top of it. That's about the only thing that's still left of the original Stanley Cup because as they keep adding teams and names. But it was 128 years ago that the former Governor General Lord Stanley pledged to donate a Silver Challenge Cup to be awarded for the best hockey team in Canada. It was later renamed after him, the Stanley Cup. The Stanley Cup is the oldest existing trophy to be awarded to a professional sports team in North America. They first awarded it all those years ago. Since the 1915 season, the Cup has been won by a combined 103 times by 20 current NHL teams and 5 NHL teams that don't exist anymore. It was not awarded in 1919 because they had the Spanish flu epidemic. That's why Seattle didn't win the Stanley Cup back in 1919. Of course, they didn't award it in 2005 because there was no season. The owners locked out the players. Happy birthday to the Stanley Cup. And finally, March 18th, 1990, At the Isabella Stewart Gardner Museum in Boston, Massachusetts, 2 guards admitted 2 men who were dressed and posing as police officers who were responding to a disturbance call at the museum. And the museum guards let them in, and the 2 fake police officers tied up the museum guards, and for the next hour, they looted the museum and made off with 12 paintings worth $500 million, the largest art theft in this country's history. It happened 30 years ago today. No arrests have ever been made. The artwork has never been recovered. The $10 million award is still out there, so if you know where the paintings are, give the museum a call in Boston. Birthdays. We always do presidents, of course. Grover Cleveland has an interesting backstory. He was born in the state in 1837, died in 1908 at the age of 71. He was both the 22nd and the 24th president of the United States, the only president in American history to serve 2 non-consecutive terms in office, and alongside Woodrow Wilson, one of only 2 Democrats elected president in the 72-year period between 1860 and 1932. Yeah, the Republicans dominated the executive branch for a long, long time. Grover Cleveland, during the 1884 presidential campaign, was accused of fathering a child out of wedlock, which would have buried any candidacy today. You know what Grover Cleveland did? He said, yeah, I did it. I've been paying child support. People were fine with it. He is the only president who actually got married in the White House. He married Frances Folsom in the White House. He was 49, she was 21. They ended up having 5 children together. And finally, Grover Cleveland had a tumor removed from the roof of his mouth while he was president that was not made public until 1917, 9 years after his death. Grover Cleveland, born in the state in 1837. Most historians consider him a pretty good president. And finally, the great New Zealand rugby player, Rico Ione, is 23 years old today. I love whenever I see New Zealand rugby on TV, I always hope that Rico Ione is playing because he's my favorite. He's 23 today. Bottom of the hour, a little past the bottom of the hour. Mike McNighty's got an opinion coming your way, and then my conversation with Bruce Buckles and Diane Tribble of Aging and Adult Care. Very fascinating, very informative. Don't miss it. It's coming up. You're watching Wake Up on Wenatchee Valley on the NCW Live channel.
Highlander Grill and Golf Course is known as one of the finest wedding venues in the Wenatchee area. You do not have to be a member to come to Highlander. Highlander Golf Course offers a first-class backdrop for your wedding day. Our friendly professional staff will ensure your wedding and reception is picture perfect, from every moment leading up to the I-dos to when the lights go down at the end of your reception. Hi, I'm Shalane, site coordinator for Highlander Grill. Give me a call to schedule your event today.
Is search engine optimization right for my business? Maybe. Studies show the first and second search results get 50% of all the clicks. But you have to fight national chains to get there. If the user has to scroll down to find you, tough luck. You could hide a dead body on page 2 and the whole zombie apocalypse on page 3. Or you could spend less and get an ad in the Impact Big Print phone book, giving local businesses a chance to shine.
Impact Directories. Bigger print, better book.
The world around us is constantly changing. Major employers in North Central Washington have expressed a need for capable, qualified engineering technologists who can think critically and solve problems. And at Wenatchee Valley College, we listened. We are pleased to offer a Bachelor of Applied Science Engineering Technology degree to provide you with a world of new opportunities. Your time is now. The future is waiting for you.
Mad Dog McNighty, and everybody is entitled to my opinion. A friend of mine once told me that he had issues with gay people because, I quote, I can't accept the gay lifestyle. So I said to him, the gay lifestyle, who determines that? I said, he and I were longtime married heterosexual men who were committed to their wives and families. And I said, do we represent the straight heterosexual lifestyle, or does somebody like Madonna, the Kardashians, or that Mo Hugh Hefner? Are these people who represent the hetero lifestyle? The lifestyles of gay people I know just really aren't that much different than mine. These folks love their families, work hard at their jobs, want a better life for their kids, and they just want to come home from work, suck down a brewski, and watch reruns on TV. The gay lifestyle. Okay, whatever. Okay. This is Mike Mad Dog McNaughty, and that's my opinion.
When you call Dick's Heating and Air Conditioning, you get 35 years of experience and customer service in the Wenatchee Valley. Dick's friendly staff strongly believe in repairing before replacing and service all major brands of HVAC units. Dick's Heating and Air Conditioning is your local, independent, trained comfort specialists, proudly serving all of North Central Washington. Call 884-6444 today.
Green Motion e-bikes have rolled into Wenatchee. We've got fun, affordable e-bikes for the whole family. Portable e-bikes that fit right in the trunk of your car. Fat tire mountain bikes plus unique vintage style bikes you won't find anywhere else. Get some exercise with pedal assist or just cruise up to 20 miles per hour with the throttle. Starting under $1,000, Green Motion e-bikes are affordable fun for the whole family. Green Motion e-bikes is located right downtown on the corner of Palouse and Wenatchee Avenue.
Welcome back. I am Dan Kuntz. I'm going to introduce the two people to my immediate left who have some very important information to pass along to you, specifically the elderly and senior population in North Central Washington, who, as we know by now, are the most at risk for the COVID-19 virus. Bruce, I'll let you two do the honors of introducing yourselves to our television family, please. Bruce, I'll let you go first.
Thank you. I'm Bruce Buckles with Aging and Adult Care. And we have served this valley for over 30 years, and we hope to do it for another 30 years, at least.
All right, I'm Diane Tribble, Director of Information and Assistance at Aging and Adult Care. And as Bruce said, we serve the population that lives at home and chooses to have care in their homes rather than moving to facilities for care.
And that's really one of the things we're going to be concentrating on, but I know this is going to be a stupid question to ask Diane and Bruce to begin with, but over the last 10 days to 2 weeks, how you guys doing right now?
Well, actually, it's been on our radar as a serious concern for much longer than that. The experience of Life Care Center in Kirkland was somewhere I started my nursing home administration career back in 1981. So when we heard the stories of what was happening there, it became very real and very disconcerting. And we have been very involved with, certainly we work with DSHS and the Department of Health in terms of providing for information and disseminating information to all of the people that we serve, as well as long-term care facilities. We also work with the Ombuds program, for not only senior health, but also for mental health. So we have a number of different ties to the community that are affected by this serious outbreak.
And it is a very serious outbreak. Again, a lot of seniors choose not to live in retirement communities. They choose to live on their own, and more power to them. But Diane, they are, as we mentioned at the start of this conversation, they are at the most at risk to not only contract coronavirus, but to be seriously affected health-wise.
That's true. And so we've, in an order to try to limit exposure to clients and to our staff, we've had to reduce our services in terms of going into homes and doing assessments, because that's what the bulk of our staff do. We are case managers, and we each have a caseload of individuals who access their programs either through Medicaid funded services, or we have some other programs that are not fully funded by Medicaid. And many of them are family caregivers, so they have family members or friends taking care of them at home. And so each of our staff are responsible for doing assessments and developing care plans to make sure that they have their needs met at home for care. So in order to limit exposure, as I mentioned, we, as of yesterday, have heard from Department of Social and Health Services that we are permitted to do our work over the phone. We're permitted to do assessments telephonically, develop care plans telephonically, and even as individuals who need assistance come to our offices, that we are to serve them with a follow-up phone call, unless absolutely necessary for face-to-face visit.
And that is not the way you normally do business.
That is not the way we normally do business.
However, one thing we anticipate is having to do more business. One of the things we are very involved with are the congregate as well as home delivered nutrition programs throughout our 6-county service area. So we work very intensely with senior centers and others to make sure that people have access to good nutrition. So now we're looking at, again, some changes in how that is going about. We're going to have to develop a much more robust home delivery program involving more volunteers. We're looking at a host of different changes that will make us able to serve people in more effective ways and wider ways in the midst of this tragic situation that we're facing.
And how is that being implemented as we speak? I mean, are you putting out the call for volunteers? You know, work with some of the organizations that already do this, such as like Mobile Meals of Wenatchee,
Yes.
Organizations like that?
Yes, we have a number of vendors that we contract with for the senior centers, and we are working with them to see how we can make sure that the availability of nutrition continues. And in fact, it probably will be extended because of the fact that there will be more people in need because of the lack of mobility. What is critical, which I think the governor has done an excellent job of advocating, is social distancing. That is the first thing and necessary thing that we need to do in the midst of this outbreak. And it's something that we are encouraging and trying to practice as much as possible as an organization, as well as assisting other organizations to do that. We're working very closely with the Chelan Douglas Health Department as well as the other health departments, and we will be having a webinar for all of our long-term care facilities tomorrow. We have a number of efforts we're looking at to again achieve those objectives differently than what we have in the past. It is the case. We would like to hug everyone who comes in, but and it's been our joy to really be very much out in the community. But we're going to have to again look at some new and creative ways to do it, and we're positive and hopeful that we can do that. And I think one of the most important messages we need to share with everyone is there is hope. There is a great deal of hope. We can, I think, as a community, and I'm referring to the greater community of North Central Washington, come together in manners that change how we have been providing service, but at the same time increase our ability to serve people. We have to. It is imperative that we do so. And there are smarter ways in which we can address this outbreak. Social distancing, the basic hygiene 101 in terms of making sure that people wash their hands frequently, are very careful about contacts. There are some great directions by the Department of Health, and they need to be heeded. People need to listen, because this is serious. It is the case where what's fascinating when we talk about issues of fear, for instance, in terms of diseases per day worldwide, the number one is tuberculosis, followed by hepatitis and pneumonia, and then HIV and AIDS and malaria. And we can go down the list, and about 3/4 of the way down the list is the COVID-19. And so we at this time have the ability to make a great difference in how this is going to play out, but we have to work together and follow the directions of the Department of Health in order to achieve that.
Do you have anything to add to that? Bruce touched on a lot of subjects there, a lot of great information.
Right. Well, from the stance of our agency, and we cover Adams, Chelan, Douglas, Grant, Lincoln, and Okanagan counties. We are developing lists, or taking our lists of clients and developing lists of those who are most vulnerable in terms of not having what we would call informal supports. So that would be family members or friends who could bring them groceries and supplies. So we're going through our lists and determining, okay, who may need the most assistance at home, and how can we provide that to them. And so going forward, we would be checking in with them and making sure that they have what they need met, if we can at all. We're developing lists of resources that we can turn to and refer them to, or call on their behalf to see if their needs can be met via other resources that could come to their home and deliver things. And the nice thing is, even in our current programs, things like supplies such as medical equipment, incontinence supplies, a lot of our clients rely on those items. We already deliver those by UPS or FedEx, and so at least that's already in place. And the individuals we help, about 2/3 of them actually have family members and friends already who are taking care of them. So what happens is, through the Medicaid program, those caregivers are being paid to provide care. So that's already in place with about 2/3 of our clients. The other third receive services from home care agencies. So a home care worker comes into the home and does the care for them. And so that's a little bit stressful, because some people are saying, I don't want my service. They're already saying, I really don't want my home care worker coming into my home.
Understandable.
Yes, understandable. And then on the flip side, some people who may become more ill may need home care workers to come in, or the home care workers may themselves become ill and be unable to fulfill their current job responsibilities. So we have to watch that moving forward and work with the home care agencies to make sure that the client's needs are being met, but they're also having their choices respected, as in, I don't really want that person to come into my home right now.
We have pointed this out during the news, and I'll ask your reaction both to Diane and Bruce. One of the reasons that there are so many more cases being reported every day is that there's more testing going on. So people need to understand that, yes, we are seeing 100 new cases a day in this state. Most of them, of course, are relegated to the Kingston-Holmes County area, but it's all over the state now. But it's because there's more testing going on, and that needs to be stressed, does it not?
It does, and it is important in terms of the triaging for testing. There is a protocol that Confluence is carefully following in terms of providing for that evaluation. And to be frank, we have really just fundamentally started testing to the degree that we should be. It will be expanded greatly, and with that will become, again, more aware of people testing positive. At the same time, it is critical to give people that knowledge so they can care for themselves and also prevent them from transmitting it to others. So that is a fundamental basis for dealing with this outbreak.
The one and only fatality so far in the North Central Washington area is in your jurisdiction, came out of Grant County. Officials there believe that the deceased, they know that the deceased did not travel anywhere, that somebody, in fact, visiting the Quincy area came into physical contact with this person and passed the COVID-19 virus onto this person, who eventually died from that. From an organizational standpoint, do people need to go, okay, this is what I've been doing for the last 3 weeks when I was out and about, because I didn't know that this was going on, as far as their personal contact before this outbreak became what it is now today?
I'm not clear what you're asking.
Well, for, the retirement communities, they keep a pretty close eye on the comings and goings of their client and the people who live there. It's the people who live on their own, who have been out and about, not knowing that they may be exposed to the coronavirus. Do they need to start thinking about where they've been and where they've been going over the last month or so?
I think it behooves them to think about it in terms of trying to look back and presume where possibly they could have had contact. I think they need to be more aware of the symptoms. If they're having some symptoms, they need to call their primary care provider and discuss those symptoms with them immediately, especially if they're age 65 and older. It even becomes more critical. That's the highest risk group. And it behooves us to think very much about the possibility of interactions where we could have been affected. The folks who are at the greatest risk are healthcare providers. Those in emergency rooms, those even in primary care settings. And they have a great responsibility and challenge continuously to address, again, the potential for transmission. That's why universal precautions are necessary. And in terms of facilities, the good news is most of the facilities in Washington have the highest levels of being careful in terms of infection control and having the ability to provide for effective isolation when something happens immediately. It's the unknowing factor that unfortunately comes with this, because there are some people who have no symptoms who will nevertheless transmit.
Exactly.
And there lies the puzzle as well as the challenge. That's why we need to, in every situation, provide for universal precautions.
Are your patrons handling this situation okay in your opinion? I'll start asking you, Diana. I mean, there's just nobody really going a lot.
Well, actually, we serve many clients who have complex issues and illnesses, and many times that's combined with mental health issues. And so we've already seen some clients who are very concerned for their well-being and a little bit panicked. And you can imagine, because maybe they have anxiety issues already. So that's already been something that we're hearing about, and we expect to hear more about that. But the home care agencies are very compassionate. They stick by their clients, and they are trained in the universal precautions of wearing gloves, of wearing masks, of wearing gowns. They are trained in that manner. So if it's necessary to don all of those items, or even if it's not necessarily required at that moment in time, but that client feels like it is, they're going to accommodate, because they're very sensitive to the care needs of their clients and very committed to them.
How's your staff handling all this? This must be an incredibly stressful time for the staff at Aging Adult Care.
Yeah.
You're doing okay?
It is stressful, and we're moving also. That's the other interesting thing.
This is supposed to be a great time for you.
I
Your
know.
new offices.
Brand new, beautiful building.
Yeah. Yes. However, we, I think, are doing a job that reflects our commitment to serve the elderly and disabled. And that goes a long way, I believe, in helping us overcome some of our personal anxieties and concerns. We all know that we have to make changes, that we have to adjust, and we have a great responsibility. The issue of fear has been said, the greatest thing we have to fear is fear itself. Mm-hmm. And I think that's very true. And the other issue is the fact that we serve many people who have the potential to become lonely. And loneliness is...
Everything it's cracked up to be.
It is, right. And it leads to depression. And that's one of the things we're looking at is doing some interventions via phone and other ways in which we will hopefully be able to help alleviate some of that concern and stress.
Well, let's close with that. And Bruce, Diane, I'll give you the last word on where Aging Adult Care goes from here and what people need to know, the most pertinent information as we have this conversation. Bruce, I'll let you take it to the end here. Go ahead.
Well, again, we would urge people to listen very closely to the Department of Health. We have a great Department of Health, Chelan Douglas, as well as the other departments down in Grant County and Adams and Lincoln County. And we are very fortunate in North Central Washington that we have the leadership we have. Also with Confluence. Confluence has stepped up to the plate in an extraordinary way. in terms of addressing this challenge, as well as the community health clinics. When I think of Dr. Rutherford and David Olson and a host of others, they have really seized the opportunity to do the very best and put the best practices in place. And I also have to commend our legal community. When I think of the great job, a number of the lawyers who I know, they're still committed to serve people with the issue of guardianship and meet their needs in many different ways. So we've seen a lot of professionals coming together in remarkable ways to continue to provide seamless care for their patients and their clients, and we hope to do the same. We're committed to it, and it is all a learning process. We have not had a pandemic like this since 1918.
And I wasn't around for that. Neither were you.
But the fascinating, we have great history. John Barry wrote an incredible book on the great Spanish flu epidemic of 1918. And so there's stuff we can learn from history, but we also are in a great position here to be able, as a community, to come together and deal with this in a very successful way, which will limit how severe it can be. So I have a great deal of hope, and I would encourage all of your listeners to do the same.
While we were talking, your phone was buzzing off the hook in your pocket. Your phone was just ringing off camera,
I'm
Diane.
so sorry.
So I'm going to let you go back to the very important work that you do, and I do appreciate you coming by and paying us a visit. And any time you want to come by and move forward on this, so you're more than welcome to. We appreciate it.
Thank you for the opportunity to be here.
Absolutely,
We're honored to be here with you.
If you're watching the NCW Life channel, we'll be right back.
When Mike leaves town, it's a little scary. You never know who might be outside. But we feel safer inside knowing our home is being monitored by a local company. I can check our alarm from just about anywhere. So when we get home, I know it's safe.
Protect your family and save money with a local company. Switch your current security monitoring to Guardian Services from LocalTel. Call Guardian Security from LocalTel now or visit localtel.net to learn more.
I'm Dr. Wayne Latimer. I'm a chiropractic physician. I have postgraduate certifications in both whiplash, trauma and rehab, as well as sports medicine. The location is great. The light and the visibility, the 17-foot ceilings are fantastic. You can go into a lot of clinics and it's very clinical. People really like the spa environment. So my whole premise was take a spa environment, add the very serious rehab, and give people an enjoyable way to get better over time.
Did you know that nearly 50% of pet poisoning cases involve human medications and prescription drugs? Sometimes the culprit's a curious dog, but cats get into their share of trouble as well. Other times, pet owners mistakenly give their pets their own medications that are safe to people but toxic to their pets. Dr. Shauna Baez and her staff care about your pets. Go to pawsandclawsvh.com for a complete list of medications to avoid or call 888-PAWS.
And we are back. What do you say we close out this Wednesday, the 18th day of March, with some good news? A beautiful weather forecast. Thank you very much, Mother Nature. This is just what the doctor ordered. Lots of sunshine today, warmer than it was yesterday. We only hit 52 yesterday. That was actually below normal. We should be right around 54 or 55 for our afternoon highs normally. As you can see, we're going to be above that, about 58 for the afternoon high today, with just a little bit of high clouds here and there. There are clouds out there. They're just missing us. Most of the clouds and the precipitation is either going to the north or the south of us, so we'll take that. 33 for the overnight low. It's 30 degrees, by the way, right now outside of our studios. We'll do it again tomorrow. Just a couple of few high clouds coming in. It's going to keep us a little bit cooler, maybe 56 for the afternoon high on Thursday. A couple of clouds Thursday night, no big deal. 33 for the overnight low. Friday is the first full day of spring, and it looks great. Sunshine and 61 degrees. I think I'm going to be taking some time off on Friday and getting out and enjoying the sunshine. Get out of the house on my self-quarantine. 36 or 35 or so for the overnight low into Friday. And here's the weekend. Saturday, sunshine, 61 degrees. And then a weak shortwave system starts coming in. And we could see a little bit of light rain. It's possible Monday night into Tuesday. Don't know if it's going to happen. I don't think so. but certainly it's going to be more clouds and sun, kind of a mixture of both, with highs still above normal. We'll take that until we get to Tuesday. No snow at all in the forecast for the mountain passes until Monday night. Have a good and safe Wednesday. We'll see you tomorrow. Take care. Bye-bye.